Thank you, Senator Burr. Dr. Walensky, I think from the get-go, there's been that uncertainty of when we arrive at the moment when many of us feel that this is truly in the rearview mirror. And from the early conversations I've had being on this committee, it's always been interesting to understand, I think, if and when that comes with clarity, that's the only way I think we get true comfort back into the country. Senator Murphy, others have mentioned how things have changed, goalposts have moved. I think that's inherently confusing to people, especially ones that might have other reasons for not getting vaccinated, and I think that is so important that we get there, everyone vaccinated. My question is, I think on the education side of it, more emphasis and resources need to be put into rural America, I think along with the logistics that have been some effort made there to improve it. I think it's inherently more difficult to get vaccines in the arms when it's spread out in areas like that. But I'd like you to zero in on, it was 3 feet or 6 feet and then 3 feet, indoors and outdoors. So many things have evolved, and I think with something as uncertain as this, it's natural to have that dynamic. Where in time and does natural infection go along with vaccination to have some weight in that point in time where cases really start to fall off the chart?
Thank you so much for those questions, Senator. Maybe I'll start briefly with the rural and say, in our efforts over this last several weeks, resources have gone broadly to rural communities. We are now funding federally qualified healthcare centers, getting vaccines into areas in those centers. Over 5 million vaccine doses have been given through federally FQHC. So we know we need to do that outreach, and that is part of this next chapter. In terms of the 6 versus 3 feet, I think from the school guidance, I know from the school guidance, the first iteration that was put out in February, the biggest challenge to getting children back to school was the 6-foot guidance. What happened soon thereafter is science emerged. And because 6 feet proved to be such a challenge, within a month, we had 3 studies that demonstrated that 3 feet and 6 feet were equivalent for younger children. And so it was based on those science. I would really like to say that we're in a static situation here and that the science isn't changing, but we are changing our guidance as the science evolves and as the science emerges, and we have to remain humble to that science. With regard to your question regarding natural immunity, we have several challenges there. The CDC on its website has a map of presumed seroprevalence by state as to how many people out there have antibodies. And of course, we don't know all of the infection that has happened, right? Because much of this infection has been asymptomatic. As Dr. Fauci has said, that prior infection likely confers some immunity. It might confer full immunity for some period of time. But I will say that we're still learning and being humble here. This past week, our genomic surveillance data demonstrated that 72% of our sequences are now the B117 variant. What do we know about how long prior infection will last with regard to new infection and a B117 variant if you're not vaccinated? We don't have all of those data yet. We're doing studies, we're evaluating it, but I do think that we should continue to encourage vaccination of people who have had disease before.
Thank you. Dr. Fauci, J&J vaccine, which I think for many people was a preference in terms of just being one shot, had a high efficacy rate to boot. Do you think it was a mistake in that we pulled it when statistically the rate of an incident was so low, lower than I think on many other drugs out there that seemingly have much higher side effect consequences? Was that a setback that put us in a place that has really hurt us, or have we recovered from it?
I don't believe it was a setback, Senator, and I think if it was, we certainly have recovered from it, because we now know when you ask people, there's a lot of people who really want to get a 1-dose vaccine, who are waiting for the availability of this. What I do think it did, that you don't fully appreciate, is that it really underscored how seriously we take safety. Because to call a pause on a adverse event that, as you mentioned correctly, is really quite rare, because at the time there were 6 cases in about 7 million people, which is less than 1 per million, which is really a very, very low amount. The FDA and the CDC looked at the data. They wanted to find out if there are any more. They wanted to alert the physicians who might be out there seeing patients about what the proper way to treat them, because there's one general way to treat that people might use that would actually be contraindicated, namely with heparin. So in the long run, in the big picture, when all is said and done, I do not believe it was a setback. I think it really underscored how seriously we all take safety.
How many vaccinations do we need to get fully in the arms to be at what the theoretical herd immunity would be and cases crash? Anybody?
Yeah, I think that's going to be a difficult number to give, because herd immunity as a concept means you get enough people vaccinated, enough people infected, so that you have a core of protected people that's a blanket of protection over even the vulnerables who cannot. The threshold of herd immunity is a number we don't know yet for this particular virus. We know it for measles, but we don't know yet what that is. We can guess it's somewhere between 70.
That uncertainty is probably the thing that is going to be the hardest thing to grapple with to get this fully in the rearview mirror. So thank you.
Senator Braun.